My name is Emily Burgos, and I'd like to give the class my persuasive speech. The pandemic has ripped open all of the flaws of healthcare, particularly regarding staffing issues in acute care settings, which is in the hospital, and nurses are at the front line saving patients' lives. According to BMJ Journals, a weekly peer-reviewed medical trade journal published by the British Medical Association on August 8th of 2020, average staffing in some hospitals on the medical surgical units is up to 9.7 patients per nurse. And this has caused significant burnout and driven nurses away from the bedside like animals running away from a forest fire. And it has also caused sentinel events, meaning preventable accidents in a healthcare setting that cause death or serious physical or psychological harm to a patient unrelated to what brought them to the hospital to skyrocket. Therefore, it is important to understand, for the safety of your loved ones and yourself, when ill, that safe staffing in acute care settings is important for the safety of patients. We are currently in a global nursing shortage. Improper staffing ratios is one of the main causes of burnout in hospitals and leads to negative patient outcomes. Better nurse-to-patient ratios have improved patient outcomes and saved hospitals money, unlike what is commonly believed. To understand why proper staffing ratios are so important, the current nursing shortage must be addressed. The International Council of Nurses wrote a policy brief on the 11th of March of 2021, which stated that the global nursing shortage was a well-recognized issue prior to the pandemic. The issue of not having enough nurses to go around has been heavily researched for at least 3 decades. They are the boots on the ground in the hospital providing patient care, and they are the face that patients see regularly in the hospital. And because of that, they're oftentimes the first ones to catch when a patient starts crashing. They are the first ones to see that blood pressure dropping. They are the first ones to see that heart rate jacking up. The World Health Organization reported on the 18th of March of 2022 for all countries to reach Sustainable Development Goal 3, good health and well-being. The WHO estimates that the world will need an additional 9 million nurses and midwives by the year of 2030. We currently have approximately 27 million nurses, meaning that we are only 3/4 of the way there and we are still currently short nurses. The British Medical Bulletin stated on the 13th of May of 2021 that the demand for nurses is increasing in all countries. Better workforce planning in nursing is crucial to reduce health inequalities and ensure sustainable health systems. We need more nurses now to ensure that our health systems stay safe. The global nursing shortage has exacerbated staffing situations and the mental health of nurses in hospitals, which is my next point. Poor staffing in hospitals wears nurses down. The American Organization of Nurse Leaders stated in August of 2021 that following staffing shortages was low morale and burnout, which is the top new challenge in February of 2021. Emotional health among nurses is declining, while safe staffing shortages are increasing at a staggering rate. What does that mean for you as a potential patient? Tired, overworked nurses that may or may not have the energy to provide the best patient care possible for you. According to the International Journal of Humanities, Arts, Medicine, and Science in May of 2016, the relationship between burnout and the nursing shortage is cyclical. Job dissatisfaction breeds the syndrome of job burnout, which in turn leads to nurse turnover and subsequent nursing shortages. And the insufficient staffing further increases job dissatisfaction. It all goes full circle. A study conducted by Jin Jun of the Ohio State University College of Nursing concluded on March 26th of 2021 that nurse burnout is associated with worsening safety and quality of care, decreased patient satisfaction, and nurses' organizational commitment and productivity. Poor staffing and burnout go hand in hand, and all of this leads to patients suffering, which is my next point. More patients per nurse leads to negative patient outcomes. According to the American Journal of Infection Control on the 9th of December of 2020, each additional patient per nurse is associated with 12% higher odds of inpatient mortality, 7% higher odds of 60-day mortality, 7% higher odds of 60-day readmission, and longer lengths of stay in the hospital. This means that every patient a nurse has, every extra patient, will increase the likelihood of a patient dying in the hospital or 60 days after being discharged. And it increases the likelihood of a patient coming back, and it keeps them in the hospital for longer. This is because the more patients a nurse has, the less time they have for each patient. On October 10th of 2019, Eastern Michigan University asked how understaffing has led to negative patient outcomes. And they say, healthcare facilities that do not keep an adequate number of nurses on duty can jeopardize the safety of their patients. Overworked nurses may suffer from fatigue or burnout, which can impair their ability to focus on tasks. This lack of focus can lead to medical errors, a lack of engagement, and missed nursing care. Patients in understaffed facilities face an increased rate of in-hospital mortality, a higher risk of infection, a rise in post-operative complications, which can be wound dehiscence, which means after surgery, when the site of incision starts to separate because of either infection, or it could be from swelling, and it starts just opening up again. And it also increases the number of falls. These are those negative patient outcomes and sentinel events that I was talking about earlier. Each extra patient a nurse has increases the patient's chance of having a negative outcome in the hospital. And these negative outcomes are forcing states and Congress to take action. That leads into my next point, that laws and regulations on nurse staffing are being placed to improve staffing in nurses. Those laws are helping patients do better. In 1999, California became the first state to enact a law ensuring a minimum nurse-to-patient ratio in the hospital. This set the stage for other states to take action. The American Nurses Association noted that, as of March of 2022, 16 states currently address nurse staffing in hospitals through their laws or regulations. A bill titled the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2021 has been introduced to Congress by Senator Sherrod Brown on May 11th of 2021, which has been read twice by Congress and referred to the Committee on Health, Education, Labor, and Pensions, and it states that it is intended to amend the Public Health Service Act to establish direct care registered nurse-to-patient ratios in hospitals and for other purposes. Laws and regulations are being placed to improve staffing for nurses. And this all may sound expensive for hospitals. Retaining nurses saves hospitals money. It's expensive to onboard a new nurse, and especially if they're a new grad fresh out of nursing school. It costs thousands upon thousands of dollars to hire a new nurse and to train them, to teach them all of the policies that they need to know to be able to safely practice. According to the New Jersey State Nurses Association, on October 15th of 2021, the average cost of turnover for a bedside RN is approximately $40,000, and each percent change in RN turnover costs or saves the hospital an average of $270,000 per year. And that same article states that about 24% of RNs turn over in the first year in that hospital. That means 24% of those nurses, those $40,000 have just been thrown down the toilet. They've just been flushed. According to the Healthcare Management Review in 2013, there was a consistent positive relationship between self-reported better work environment and hospital financial performance. According to the Health Services research in 2012, hospitals' cost of complying with nurse ratios in California should be offset by fewer complications, which can be infection or wound dehiscence like I was talking about earlier, shorter patient stays and fewer readmissions, less need for temporary and travel nursing, and lower nursing staff turnover. Safe staffing saves hospitals money by increasing patient safety and retaining staff. It is important to understand, as a potential patient, the effects of staffing in hospitals and why safe staffing is crucial. We are currently in a global nursing shortage that has caused burnout and negative patient outcomes. And if we have more nurses, hospitals will save money and patients will have better outcomes. I would like to finish with a quote from President-elect Kennedy of the International Council of Nurses on March 11th of 2021. I am deeply concerned about the state of the nursing profession. The mental and physical trauma nurses have endured over the past year, and the many who may suffer post-traumatic stress. The strain that nurses are under is unacceptable, and it is no surprise that so many are feeling the pressure and deciding that they can no longer continue with the jobs that they love. When dedicated and experienced nurses call time on their profession, it is a clear indication that something is seriously wrong. Nurses cannot be expected to continue if they are overworked and undervalued. Our nurses have gone way beyond the call of duty this past year. Governments must now repay their dedication and commitment with the support nurses need to carry on their vital work for the patients, families, and communities that they serve so well. Thank you.